Okay, one of the things that we see very commonly in our patients post-op is they get thrush. And thrush is basically a yeast infection that occurs only in the first couple of days post-op. And the reason it occurs right after surgery is your body is burning some fat. And that fat gets metabolized into different chemicals as it goes from the long chain fatty acids, the actual storage system for fat, gets broken down into smaller and smaller pieces until it's into a chemical that you've probably heard before. If you've ever been on a high fat or high protein diet, you've probably heard about ketones, because you want to become ketogenic. You might have even gone to the drugstore and bought dipsticks to measure your urine to make sure that you were ketotic because you wanted to be fat burning. And it turns out you are now burning some fat. Okay? That's a good thing. But the ketone is like the chemical acetone. And if you've ever, that's the stuff they use to take fingernail polish off. If you ever smell that, it's a very powerful organic chemical. Some of that in small amounts is being released into your mouth. And that chemical gives you that icky bad breath that you just can't clean your tongue with. You can brush and can't make it better. And it also kills some of the regular, usual bacteria that's in your gut and in your mouth. And what grows instead, what can grow in there, is a yeast called Candida. And when that grows in there, you get that yeast infection, and that usually passes as you get over the initial burst of fat burning. And so that's why you get thrush. And it's only a risk the first couple of days.